Thank you, Mr. Chair, and thank you, Mr. Duclos, for being here today. I want to say right off the top that we're here today not because we don't believe that data is important and evidence-based data is important to manage the pandemic. I think every one of us around the table understand that information is important. The question is, and why we're here today, is because of an RFP that was produced by, as the Minister said, was put out in December, which brought to light a situation that the mobility data of Canadians was being collected, as the Minister said, since March of 2020. Now, let me tell you what this is about. And I'll ask the Minister a question in a second. This is about the fact that it was being done without the knowledge and without the consent of Canadians. That's what's so alarming about this. The other thing is that the Privacy Commissioner, and I know that there's been on a couple of occasions, information that is contrary or contradictory to each other, but the Privacy Commissioner's office said that they had not been contacted about this practice being done. So there are conflicting reports on that. Now, you can speak to anonymized data all you want, aggregated data. There are security and privacy experts, Mr. Chair, who have expressed sincere concern about the security measures and the protocols that were put in place in order to protect the privacy of Canadians. And ensuring their privacy isn't compromised. Now, we are going to hear from experts as we move on further into the study who are going to talk to us about how easy it is to re-identify or de-identify that data for commercial purposes. So my question to the Minister is, does he not understand the concern that has come to light as a result of this?
Thank you, Mr. Chair. If I may now answer the question. First, thank you to our colleague, Mr. Brassard, for stating from the start that the use of science and the use of information has been key, not only to save billions of dollars and hundreds of thousands of jobs, but to save tens of thousands of lives. The reason, the outcome of what we've done in the last 20 months, I repeat, using information, data, and science has saved in Canada tens of thousands of lives. In Canada, compared to all other countries in the G7, except for Japan, our death rate is significantly lower. If we had followed the example of our southern border friend, we would have had 60,000 more people dying in Canada. So we can congratulate each other on those actions based on science and data. The second thing we absolutely all agree on, and Mr. Brassard certainly stated that very clearly, is the absolute priority to protect the information of Canadians. And that's why identified, aggregated, anonymized data have used, and 1.7 million Canadians over the last few months have been able to see those data on the web. It's been there since 2020. It was announced by the Prime Minister in March 2020. It was implemented in April 2020. And as of January, 1.7 million Canadians have been able to see those data on the web. So nothing secret, everything transparent, fully science-based, and saving lots of lives.
Mr. Duclos, can I ask why the Privacy Commissioner wasn't consulted on this practice before it started?
The Privacy Commissioner was informed, and there was a conversation right at the start of the pandemic in April 2020.
Informed?
There was a bi-weekly meeting with the Privacy Commissioner twice a month, therefore. Since April 2020, it was determined that the information that was being used was not private, was not confidential, following the regulations and the laws of the government of Canada.
Thank you, sir. The Privacy Commissioner, there is conflicting reports about the Privacy Commissioner's office not being consulted in advance of this information being put out there. In fact, PHAC officials said that they went to security and privacy experts. Who did they use, if not the Privacy Commissioner, for that advice?
the legal experts of the government of Canada determined early in the process with the collaboration of various other experts, including comments made and advice provided by the Office of the Privacy Commissioner, that this information was not private and therefore did not engage the Privacy Act. Despite that, bi-weekly meetings were had with the Privacy Commissioner since April 2020 and continue to that day.
But one more question.
Who in cabinet was aware of the fact that this was going on? Which was the health minister involved with this? Did cabinet make the decision to start this practice?
You, Mr. Brassard, should have known that because it's been posted since April 2020.
Question is, who in cabinet was cabinet aware of this? That's my question.
Mr. Brassard, you don't need to be a member of the cabinet. The Prime Minister announced that in March 2020. It's been ongoing since April 2020. 1.7 million Canadians were able to visit the application and the website to look at those data.
Thank you, Minister Duclos. And now to